I would like to call upon Dr. UMARANI. Ma'am, for a young woman who is planning to conceive or who has just conceived, what is the role of nutrients and supplements, ma'am? And do we have any homeopathic substitutes for these supplements?
It is very important to eat nutritious food before a woman wants to conceive or after pregnancy also, because a good nutrition supports the baby during that first trimester, because during the first trimester there is means 3 months. So there is a development of the organs starts, like lungs, heart, brain, and other important organs also starts to develop. Okay, so during this time it is known as the organogenesis period we call, and along with that there is that during the first trimester there is a gastrulation process starts. So there is a 3 layers and neural tube formation starts, notochord formation starts. Like very important aspect starts at the first trimester. So this is a very important period for that nutritious food, along with that very important folic acid. So folic acid is a very important nutrient. Every pregnant woman must take that. Otherwise, there is a neural tube defects in the baby may happen. So folic acid must take that. It is essential nutrient. Okay, coming to here, this usually all women of childbearing age need 400 micrograms of folic acid in each day. Whereas pregnant women need 600 micrograms folic acid daily. So it is that nutrients usually we can found in the leafy vegetables, nuts, beans, citrus fruits, and there is a fortified breakfast like cereals, vitamin supplements. These are all availability will be there for the folic acid. Coming to homeopathy, so we have certain supplements like the calcarea fast is there. We can give that as along with this folic acid. Okay. So this calcarea fast patients usually it helps to strengthen a woman who tends towards easily tired. So women usually tired, feeling poor digestion, and there is a cold hands, cold feet, and poor absorption. So like this type of woman, this calcarea fast usually is helpful, and also ferrum metallicum. That woman who has that sturdy build and looks very pale. So this type of women, the ferrum met useful, and ferrum fast also useful, and it will be helpful for that sensitive nervous people. So these supplements can be used along with these during pregnancy.
Right. So supplements like CP, ferromet, ferrum phos, along with folic acid and other supplements. So yes. Both have to be taken together.
Yes.
Right, ma'am. Ma'am, and again, one more thing which comes up is usually pregnancy is a period in a woman's life which has to be enjoyed and cherished. But what happens is many of the young females today are suffering from symptoms like vomiting, like headaches, UTIs, or etc. Few symptoms during the first trimester of pregnancy.
Yes.
So, can we help them in some way?
Usually during pregnancy means antenatal period, there are few certain symptoms a female will experience that. So like as you asked about that nausea, vomiting, and cough, UTI, then backache, constipation, piles, and indigestion. Okay, and there is a skin itching of the skin, like pruritus, like all these symptoms will be there. So here that homeopathy having lot of scope in the antenatal period, because other system conventional method they don't give like painkillers much during pregnancy, first trimester, and even pregnancy also. So we have certain remedies which can help these type of symptoms suffering by that pregnant ladies. So if you take that nausea and vomiting, so usually in the first trimester and primary, Usually, the nausea, vomiting is that frequent complaints will be there. We have certain remedies, these type of symptoms, and if it is increased, means complete vomiting and nausea, then we call it is hyperemesis gravidarum. So this requires some specialization and IV fluids, and a specialist under that treatment should be given. And simple like nausea, vomiting, we have certain remedies like arsenic. We have that morning sickness. We have that very important and specific remedy, that is Symporicarpus racemosa. Okay, that remedy we can give. It is a specific remedy. So it is having my personal experience when I was pregnant. So I use this remedy. It's wonderfully uses, and after taking this remedy, and also I got some confidence again about this homeopathy in this. So self realization and self experience is very important, of course. Okay. So this remedy is very specific for this hyperemesis. And then arsenic, we know that there is sight and smell of the food causes vomiting, and the woman will be very restless and fear of death and vomiting. These complaints if female having, then arsenic we can give. Then colchicum, we can think of colchicum, and it is that odor of cooking food that causes that nausea, and there is a profuse salivation will be there for this colchicum. Okay, and epicock. So it is that nausea, constant nausea will be there for that epicock, even it is not reduced by that vomiting also. There is very clean tongue will be there for that epicock. We can think of this. And also sepia. Sepia, nausea with sore erectations. We can think of this sepia. And lactic acid. We can think of lactic acid, especially pale, anemic, then diabetic women. We can think of this lactic acid for this hyperemesis cases, whereas the morning sickness cases. And other condition we can see the toothache. Okay, because of this hormonal changes during that early pregnancy, there is a gums and teeth are more sensitive, and there is a bleeding of the gums and painful teeth. So these complaints usually that pregnant women will suffer with that. There we have certain remedies like magnesium carb. We can think of this toothache. Here the magnesium carb having the disease of open air, and here the chilly patient. So chilly patient at disease of open air. So this is the peculiar complaint. So we can think of magnesium carb, and this toothache will be worse at night time. The magnesium carb, and when quiet and the night time, cold air. So these are the worst things about the magnesium carb. And ratania, one more remedy, ratania for this toothache, and chamomilla. Chamomilla also here. Chamomilla will have the female is having very irritable anger by nature, and that even aggravation from the coffee. We can think of that chamomilla. And one more remedy, it is a staphysagria. Staphysagria also, we can take teeth painful in touch, even also. Even touch of the food and drinks also, there is that toothache will be there for this staphysagria. But when the biting and chewing, there will be no pain. Only the touch of that causes the pain. So this is the PQRS symptoms. We can think of this staphysagria. And again, sepia comes for this again toothache from the sweets, tea, like all these by that sepia we can think. So about these few very important remedies and specific remedies for the toothache in the pregnancy. And we have certain the female is having problems like pruritus of the skin in pregnancy. So in the pruritus of the skin, usually urticarial papules we can see, but there is an itching of the skin continuously. So after delivery, then itching will be reduced. But during this pregnancy, there is very discomfort about this itching. So we have certain remedies like caladium. So here elements of insect bite. So then that is a burning and itching violently. So we can think of caladium and creosote. Also we can think, and umbra gracia. There is that itching of the pudendum. So this man sepia comes again here even for this condition. So sepia, I think even after the pregnancy complaints, any skin complaints after that delivery, I have given a number of women about these skin complaints developed after the delivery, sepia. So we can think of this, okay? And one more thing, during pregnancy, headaches. Okay, so usually these headaches, instead of giving the medicine, the management is very important. So the pregnant woman should take rest sufficiently. So should avoid the stress and some exercises, some relaxation better she has to do. So apart from that, if she complaining that headache, we have number of remedies. Like again, the belladonna comes here, the headache, and Simsifuga comes here, the headache, and gelsemium comes. Again, sepia, spicelia, that right or left side, according to that, we can think of this headache, okay? And other complaints, usually during pregnancy, there is a increased abdominal pressure. So acid reflux will be there. So these may causes heartburn and indigestion in that pregnant woman. So we have certain remedies like acetic acid in this condition, and we'll have also capsicum we can think of here, and heartburn like nux vomica we can think about in these cases, and magnesium carb we can think of that, natrum phos. So we have remedies in that pregnancy, nux vomica. These are this burning and indigestion we have. And again, the frequent complaint in that here it is UTI, urinary tract infections. Okay, so here that this also management is very essential instead of medicine. So taking of the plenty of water and salts, these are very important for this UTI. And here that our remedies here means EPIs we can think of UTI infections, and equisetum we have remedy in these cases, and creosote again comes here, and one more remedy like Helonias dio, like DIOCIA, Helonias. So these also having that. So these I have chosen some first grade remedies, like in my practice I have used. So these are the remedies useful for this pregnancy. And frequently suffering complaint like backache is that one complaint from that pregnant ladies, like we have remedies for that. So we can think of Aeschylus hip can think there is a lameness of the back. Patient will complain like that lameness of the back and across that sacroiliac joint, and the pain goes from that continuously from the sacrum. So then lumbar region, lumbosacral region. So Aeschylus hip can be helpful, and arnica we can think of here. Rustox we can think, calicar backache. So it is that affinity is more on that back region, that calicar we can think of. Ledum pal, sarsaparilla, like we have numbers that backache we have. And last we can think of this constipation and piles. In the pregnant woman, there is a constipation and piles is one more commonest problem. So here also comes that Aeschylus hip comes as that here. So this is the constipation. There is a difficult hard stool, dry stool, and there is a Aeschylus hip comes. Next, ammonium moor. Ammonium moor also we can think there is a hemorrhoids. These are very sore, and there is a green mucoid stools will be there in that ammonium moor. And we can think of collinsonia in these hemorrhoids, and these are the bleeding piles. Collinsonia, can see that bleeding piles, and alumina we can think. So these are certain remedies can be used in that during antenatal care, and this during pregnancy we have certain remedies, and important symptoms can be treated by the
right, ma'am. So ma'am, the remedies which you have given, I think they are more than enough to replace antacids or painkillers or antibiotics in every household.
Yes, that's why we have a lot of scope in that antenatal checkup. Yes, that information should go to every pregnant woman. So homeopathy having a lot of scope in that area. Because their conventional only, they will avoid these painkillers during pregnancy. Certain antibiotics will not be used. Okay?
Definitely, ma'am. Our remedies hold the upper hand in these conditions.
Yes, yes.